Your source, I was really shocked. I never thought, or I've never seen that before in my life while I was in the Philippines. Also, well, what else also, one of the things also is this. Although, although here, insurance is a way of paying, your medical bills. But if you have money and you go to a nursing home, they won't give you the other insurance, which is Medicaid. They'll finish first your money. They sell your house, which I don't see it. I didn't see it over in the Philippines. Everything here is card or insurance. Over there, we pay in cash. If you don't have money, you can't go to the hospital. Over here, even if you don't have money, you can go to the hospital and still you can get the proper care. Whereas in our country, you just have to make use of the albularyo's. Right?
The privacy too, I think that's privacy where even though like certain family doesn't, if they're not entitled to know, and if there's only one family that you have to communicate with.
Oh yes, everything is centered around family and patient. You cannot just do any procedure or what do you call this, without
Family consultant.
no, you always have to consult the family. Any changes, you have to consult the family. Otherwise you get sued.
Yeah, that's what
Yeah.
happens if you don't consult with the
Yeah,
family first.
they're very, very strict here.
Yeah,
Yeah.
that's true.
What is the worst experience you ever had in caring foreign clients? How do you manage that? Well, I didn't really have any bad or worse experience. But I can tell you that the worst patients that I had are those that are drunk or crazy. Those patients that have behavior issues. Those are very hard to take care. Because, uh, you know, patients that are combative, you cannot just put restraints without doctor's order. You cannot just medicate without doctor's order. And that's why I would say that they're hard. And also the families, they're hard. They're very difficult to, what do you call, what is the word with the families? No, not communication, but the way you, how do you call that? Deal with them. If they don't like the care that their family member is getting, that's a problem. If they always complain anyway, maybe to your higher up, maybe to your higher ups, your supervisor, your director of nursing. You always have to get ready, and you always have to make sure that you're giving them the proper care. The worst thing to deal with is not the resident, because if the resident is comatose or does not communicate or does not do anything, that's the best patient that you can have. But if the families are complainant, that's a difficult one. Okay, this last question. Have you done something in your previous... Oh, it's not the last. There's more. Have you done something in your previous experiences where you accidentally violated one of your client's beliefs and practice? How did you handle that situation?
DNR, DNI, when they don't want them to do like.
Yeah, the DNR, DNH, you have to be very careful. The DNR means do not resuscitate, and DNH means do not hospitalize. But I have not encountered, these things wherein I have violated their cultural beliefs. Well, I think, you have to know your patient's religion also, because you could violate their beliefs, like, the Muslims don't eat pork. So you really have to know that, because they get offended when you give them a tray with pork. Well, that's the only thing that I know, but I have never encountered this, uh, violation of clients' cultural beliefs. And also, but let me tell you something. Some patients, if they are women, they don't want a man to take care of them. You have to bear that in mind. If they say, I don't like a man taking care of me, you make sure that that it's always a nurse, a female nurse, or a female CNA that should take care of this patient. And besides here, what resident wants, even if it's not for their own good, they always get. Like if the resident says, I want to get out of bed any time of the day, you have to get them out of bed. There's no such thing as, oh, I can't get you out because I'm by myself. You can't do that. If they refuse their medications, they have the right. All you have to do is write, chart it that they refuse. If they say they don't like to take a shower, that's their right. They don't want to take a shower even if they stink. It's always what do you call that? Customer is always right. What else? Okay. What do I think about Filipino nurses compared to other nurses from other countries? Well, first of all, we are good nurses. We always do our job. We are easy to get along. We follow orders to a T.